to disrupt global healthcare in 2023. According to Reuters news agency, data shows that the pandemic has disrupted all kinds of healthcare, from childhood immunizations to cancer screenings. Life expectancy in some countries have fallen, while mental health concerns have skyrocketed. And the impacts of long COVID are just being recognized, while gaps in national healthcare systems have been exposed as never before. We're now joined on the line by the Ministry of Health's Executive Director, Mr. Nangombe, to speak on COVID-19's resurgence. Mr. Nangombe, good evening and welcome to the Daily Roundup.
Good evening, Nina. How are you?
I'm fantastic, sir. Thank you so much for joining us.
Wonderful.
Now, COVID-19, though it didn't fully disappear, seems to have given Namibia a break in how disruptive it was when the pandemic first hit. Briefly talk to us on why COVID-19 is resurfacing and how alarmed should we actually be this time around?
Yeah, I think maybe one of the things that the public need to know is that the only way you can detect an outbreak in the diseases is if you have the mechanisms and the infrastructure to do so. So Namibia has one of the strongest surveillance systems on the continent. Mm-hmm. That is why whenever there is an outbreak of one disease or the other, our systems are able to detect through surveillance, through testing of the samples that are collected. So with regard to COVID, we know that the outbreak has reduced quite drastically, and the numbers of people infected have gone down. But through our surveillance activities that we are carrying on, we are able to pick up the clusters that are forming in different parts of the country. Mm-hmm. So that is why we are able to pick up these cases that are forming. Mm-hmm. So we have seen new cases being picked up in Khomas region, in Erongo region, also in the south, in the Karas region, we picked up some cases. But what is important to know is that the severity of those infected is very low. We have very low hospitalization, and we must continue to observe the measures that have been put in place to ensure that we don't have more infections occurring around the country.
Mm-hmm, mm-hmm. And what are the variants that have been, detected with these new cases that have popped up in the different regions, the Khomas and Karas region?
Basically, the ministry working with UNAM and NIT is able to do what is called genome sequencing. Genome sequencing means when you test for the COVID-19 cases, you get the positive cases. Those positive samples are then subjected to further testing for genome sequencing. For now, the latest reports that have been received from NIT and UNAM are still showing that it's the Omicron variant and its known subvariants are circulating in Namibia. And if there were new variants or subvariants that are detected, we will be able to inform the nation accordingly. But at the moment, the cases that are being recorded in Namibia are detected mainly by the Omicron variant.
Mm-hmm, mm-hmm. Now, winter is slowly approaching, Mr. Nangombe. How ready is the ministry for this season? Because we do know that there seems to be a surge of COVID cases during the winter periods or colder weather. What are some of the measures that you've put in place to sort of cushion the blow that could be experienced and that we know has been experienced over the past 2 years with COVID-19?
The COVID-19 pandemic, when it was at peak, taught us very hard, harsh lessons. And we did learn from lessons. You remember that one of the reasons why some of people may have died is because we did not have sufficient oxygen, for example. Mm-hmm. We did not have sufficient ICU beds, for example. Our people may not have been sufficiently trained as they should have been. So what we now have done, learning from lessons, we have installed oxygen generating systems at most of the district hospitals around the country. Where in the past, for example, you only had the capacity to generate 200 or 200 liters of oxygen per hour, we now have the capacity to generate more than 2,000 oxygen per hour at some of the facilities. We have built isolation facilities where they are fitted again with oxygen generating systems, because oxygen therapy is very important in the treatment of COVID. We have trained our people in terms of them being able to deal with the patients. We have sufficient stock of personal protective equipment that can be used when our healthcare workers are dealing with these patients. So generally, in terms of preparedness, we are on a strong footing. We are continuing to strengthen our systems through training of healthcare workers, and we are continuing to still improve the health infrastructure. The ministry is rolling out the establishment of ICUs at all our health district hospitals around the country. Some have already started, others are underway, and that is why we think that we are on a strong footing, but we are only as prepared as the nation is ready to comply with the regulations that are put in place in terms of physical distancing, in terms of getting tested, and in terms of attending to health facilities when they feel unwell.
What is the status quo right now, Mr. Nangombe, concerning vaccines and its uptake?
Yes, we are continuing to provide COVID-19 vaccines through our extended program on immunization, that is routine immunization, but we are also providing COVID-19 vaccination through targeted campaigns. We are working with some of our development cooperation partners through the Africa CDC. They have rolled out an initiative called Saving Lives and Saving Livelihoods. It is implemented through an organization known as the Project Hope in Namibia. We are working with the USAID and an entity known as UPAID to coordinate these activities. So this is ongoing. We know that there has been some vaccine hesitancy in the past, but does not take away from the efforts that the ministry is doing. And we are appealing to the nation again to listen to the authentic information coming from the Ministry of Health and Services about the importance of getting vaccination. Because at the end of the day, it is your life, it is your health, it's the health of members. And if you do not get vaccinated, and we don't know how the pandemic is going to unfold, we don't know whether there are new variants. So it is important to be protected through vaccination, so that if you are, people don't end up in ICUs, they don't end up with ventilators, and they don't end up losing their life. You could actually protect yourself through a simple act of getting vaccinated. So yes, there is some vaccine hesitancy. There are some anti-vaccine movements going on, but through our community engagement, we are providing health education to members of the public at all levels of healthcare delivery, whether it's a clinic, whether it's a health center, whether it's a district hospital. We are providing education at those facilities, encouraging people to get vaccinated, so that as a way of strengthening the public healthcare system in Namibia, that is one of the measures that we can employ to make sure that we are not visited by the danger that visited us, for example, in 2020 and 2021, when COVID-19 deaths were at their peak in our country.
I hear what you're saying in terms of providing information to the public concerning vaccines and the importance thereof and the boosters and so on. But correct me if I'm wrong. It would seem that from my observation, as much as individuals have slowed down in terms of going to get vaccinated, it also seems that the ministry has slowed down a bit in terms of the campaign around vaccinations. Would that be a correct observation, Mr. Nangombe?
No, it's like we are with the ministry. We are providing COVID-19 vaccination as part of a program known as the Extended Program on Vaccination, which basically provides routine vaccination of other vaccines against other diseases. So we have incorporated the COVID-19 vaccine in that program. In addition to that, we are working, as I indicated, with organizations like the African CDC through an initiative known as Saving Lives and Livelihoods, where we are, again, providing these services, strengthening the interventions at the districts and the regional levels so that our people go out in the communities to sensitize them about the importance of getting vaccination. And this is ongoing. So it's part of those interventions that we are making. Yes, there is, as I said, some vaccine hesitancy. There has been a strong anti-vax movement in the country. But in addition to working with our development cooperation partners, we have also made sure that when members of the public go to the clinics, when they go to the health centers, information and health education on COVID-19 and COVID-19 vaccination in particular is also provided at those levels. So it's for members of the public to internalize this message, to take this message home. We must continue to work with our traditional authorities, for example. We must continue to work with spiritual leaders in the churches. We must continue to work with employers and employers' unions. Everybody must drive this message home. We know how devastating COVID-19 was when it was at its peak in our country. We don't want to get there. And it's the responsibility of each and every Namibian to make sure that we work with the health authorities to strengthen our public health system so that we prevent unnecessary deaths. It robs our country of skills. It robs our country of experienced individuals. So we need to make sure that each and every one of us pull our weight to make sure that this doesn't happen in our country anymore. I mean, really, who wants to get back to the ugly days of COVID-19 deaths, people being buried every day almost all over the country? We don't want to get there. And the only way we can prevent ourselves from getting there is if we comply with the regulations and we spread the message about the importance of vaccination so that we can develop the necessary herd immunity. And when people are infected, they don't find themselves severely ill, finding themselves in ICUs or on ventilators being cared for by the health authorities.
Mm-hmm. How far away are we from herd immunity, Mr. Nangombe?
I think it's a difficult question to tell. The only way you will know that we have reached a certain level of herd immunity is if you carry out a study to determine how many people actually have the antibodies of COVID-19 in bodies. That study is a scientific study that needs to be made. And again, it's also complicated because a person may have some antibodies against COVID-19, but it will be difficult again to know what is the level of protection that the person enjoys. That is why it is important, for example, people to get boosters who are already vaccinated so that they are well protected against infection or against the severe disease that may reach them.
Just as we round off our discussion, what vaccines are currently readily available in the country?
The vaccines that we have in the country, we have the COVID-19, Sinopharm that we have been using, have the AstraZeneca vaccine in the country. So, but the Pfizer vaccine, we had issues in terms of availability because when we went to the COVAX facility to get the vaccines from there, there was an issue with availability. The vaccines that we were offered had a short expiry period, and we have taken a policy decision as a country that we will not accept a vaccine that is less than 6 months in terms of lifespan. Mm-hmm. So, but the vaccines such as Sinopharm readily available can be provided to those that need vaccination around it.
Fantastic. Mr. Nangombe, your final words this evening?
I think just to call upon the nation again to do what is right. We know what it takes to protect ourselves from infection by COVID-19. We know the importance of getting vaccinated so that we are protected against severe illness. Let us just continue to do that. Then we don't have to find ourselves in a difficult situation. We don't have to put pressure on our healthcare workers. Their mental health is affected as a result of this. So please, let us join hands and work together and finally break the backbone of COVID-19 so that our country can return to normalcy. I mean, how wonderful is it now that we are in a country where we actually are no longer subject to the measures of limited size of gatherings, wearing of masks in public, etc. So let us continue to do what is right, protect ourselves, get vaccinated, so that COVID-19 does not come back to hurt us as it did in the past.
Mr. Nangombe, it's always pleasant speaking to you. Thank you so much for joining us this evening.
Thank you very much.
That was Mr. Ben Nangombe, Executive Director at the Ministry of Health, speaking to us there. Let's take a look at our local news roundup and we'll be back thereafter.